Hello, friends and family. David Michael Spiggy still here and still grateful to be here. It is currently my least favorite holiday, which is spring forward. I still don't know why we do it. I think a lot of us are wondering why we do it, and hopefully by the end of our lifetimes we won't be doing it anymore. Other holidays kind of coming up. It's match week. This is the week that medical students find out if they matched, so that's tomorrow. And at the end of the week, they find out where they matched. For those who may not know, medical students go through medical school, they get their doctorate, and then afterwards they go through residencies. Residencies are 3 to ungodly amount of years afterwards, where they get kind of their board certification and their specialty training. For me, that's family medicine, so we look for every year to match 8 medical students to 8 resident spots. For family medicine, we hang out with them for 3 years and they finish in that specialty. It can be a really stressful week. We interview throughout all of a good chunk of the fall and into January, and there's a Nobel Prize winning algorithm called the Match that essentially pairs up medical students with residencies, and it can be really stressful kind of figuring out how all that process works, but we're hopeful that we'll match a lot of great folks this coming week. If not, we'll know tomorrow if we match or not, and if we didn't match enough, then we try and find some people through a process called SOAP, or the Supplemental Offer and Supplemental Offer Acceptance Program, something like that. I should know what it stands for, but essentially it's a great scramble where people try and find residency programs that will take them, and residents try and find residents or medical students that would like to come there. So could be a stressful week, could be a very easy week. Not that medicine's really ever easy, but at least easier this coming week. In terms of other updates from me, I know I was very excited to work at this kind of underserved clinic in partnership with a local Christian ministry, as well as my residency program. Due to some unfortunate circumstances, it will probably be delayed about 6 to 8 months. I don't know how much of this business I can talk about publicly, but unfortunately it looks like there is some oversight, but still fortunately it looks like it can be done and taken care of. So I'll probably start actually doing work at this underserved clinic in 6 to 8 months, optimistically. I know medically, and especially in underserved medical settings, it can be difficult sometimes to get everything in place and rolling, and it seems like that's what's happened here. I'm not too worried about it. It's just kind of doing work in underserved populations and with limited resources, things sometimes take longer. And frankly, doing things in highly resourced settings still can take longer than what you'd expect them to do. In terms of how Brit is doing very well. She completed 6 weeks of radiation. That looked like her going to the University of Michigan, about 30-45 minute drive, depending on the snow. Did it all herself. Very grateful she was able to make it in all the weather conditions without any problems, accidents, or seizures. And got her head radiated 5 out of 7 days of the week. They take her in, they strap her to a table with a but custom-made mask. But it's like screws in it. Like, can you imagine this? And then just to radiate your brain. Like, totally normal morning thing to do for 6 weeks. But she's finished that. So radiation essentially off the table for future problems that might come up with Brita. She, from a chemotherapy standpoint, tolerated the symptoms of her chemotherapy, but unfortunately her white blood cell counts were low. So last time you may remember her neutrophil counts, which are kind of like our first responders in our white blood cell system, were decreased. So we had to kind of hold and stop for a second. This time it's her lymphocytes. Lymphocytes are the cells that are kind of like the memory cells of your body in terms of exposure to things you've been exposed to. They have kind of help with the second time you're infected with something, or even the long-term kind of immunity of an acute infection. Very important. It's what HIV patients are deficient in. So as those counts decrease, she gets to go on antibiotics to help kind of prevent sort of all the bugs around us that we're just taking for granted that we can be immune to. So it's kind of frustrating because I'd like to go and do things, and I feel like we have this tension of, well, we can sort of go into these places, and maybe not this group setting, but maybe that group setting, and just kind of the wisdom and, well, what can we do and enjoy life while also being prudent, saying, look, what counts aren't great. That means going forward that they need to kind of come back up in order for her to continue her chemotherapy, which obviously is super important. The best time to get chemotherapy is kind of right around the time of your radiation. There's good evidence to support that radiation plus chemotherapy, specifically TMZ, which is what she's on, can improve outcomes. So now is kind of a great time to be on it. I really wish she was on it, but it's that or at risk for all sorts of horrible opportunistic infections, which we don't want. So that's kind of where things are at. Symptomatically, Brit is doing really well. She's still a great person, still totally functional, seizure free. I mean, lost some hair, but it's going to grow back. Like I think it's pretty good, you know. I'll take what we can get at this point. I'm just grateful for all of you. I know that I just wouldn't be able to do all the things that we needed to do. We were able to go and have people cover and take care of Perrin for 6 weeks in the morning. That was awesome and lovely. We had food. We felt very kindly taken care of, and I'm grateful for all of you. And I know from an emotional, mental, physical, and spiritual perspective, you all have been a great encouragement to me. And I'll try my best to keep updating all of you because I know you care, and I'm just grateful that you do. So thanks for that. Take care. Survive spring forward, and hopefully get back to you in a couple weeks to months here. And hopefully next steps will be an MRI at some point, kind of seeing how Brita's brain tolerated it. And then also kind of the next steps. What are we doing for chemotherapy going forward? Will it be indefinite? Will it be intermittent? There's a lot of different ways to slice that. So again, grateful for all of you. Take care.